Let's imagine better health with CHI Health. We're focusing today on common sports injuries.
Specifically, ACL tears. Patients might hear a pop in the knee and feel it give way. Reconstruction may be the best fix.
Yeah, pleasure to welcome CHI Health orthopedic surgeon Eric Samuelson. Good to see you, Doctor.
Nice to meet you, Doctor.
Good morning.
Yeah, listen, thanks for coming. Anybody in sports, maybe an athlete, most of those people know what an ACL is, right? But what is that ACL ligament?
So the ACL is one of the four main stabilizing structures of the knee. There are collateral ligaments on either side of the knee, and then the cruciate ligaments are actually in the middle. The ACL in particular prevents the shin bone or tibia from sliding forward compared to the thigh bone. It also prevents some rotational motion. It's unfortunately, it's a very common injury, second only to injuries to the MCL, but it's a very common injury that we see.
Yeah, I think about it in football a lot. Maybe that's because we're just coming off of football season.
Right,
It's on the
fans
mind.
know what the ACL is.
No,
we've
no
seen a lot of those injuries.
Are there certain sports or like cases where that injury might happen most commonly?
Well, it's actually, we commonly think of, everybody watches Sports Center and you see the highlight of somebody getting hit in the knee. It looks fairly gruesome and injures some of the ligaments, but it's actually more common to have a non-contact injury to the ACL. That happens when an athlete or a patient sustains a twisting injury to the knee with a foot planted on the ground, overloads some of the structures of the knee, including the ACL, leading to tears. Kind
of that twist, and you don't always know that something's wrong. I've seen athletes just kind of walk off the field after an ACL. How do you know something's wrong?
Well, typically patients or athletes say that they felt or heard a pop in the knee, but when you start to have a lot of swelling afterwards, people say the knee blew up like a balloon, so to speak. Trouble with the knee giving way and pain. They're typically not able to continue playing. They may be able to walk off the field, but whenever they try to run or plant and cut, they feel the knee is loose.
Yeah, there's just that support's not there.
Well, it can be season ending. It takes a while. So are there treatment courses that you recommend? I mean, maybe patient to patient it's different?
Yeah, so typically when a patient first sustains an ACL tear, we typically recommend a period for the knee to cool off a little bit, let the swelling and inflammation and pain sort of subside before deciding on further treatment. That typically includes anti-inflammatory medicines, physical therapy to start working on getting range of motion back.
Yeah, and I'm sorry, were you going to add
No,
to that?
go ahead.
You do a reconstruction to the ACL. What does that entail, and I guess who do you recommend? In what cases would you see a reconstruction?
Yeah, so I certainly, like you mentioned, every patient's different, and certain folks are able to live happy, healthy, normal lives having an ACL deficient knee, but certainly for patients, younger patients, as well as folks that want to continue pursuing a fairly active lifestyle, we typically recommend surgery to reconstruct that ligament.
Would you have a model there?
Yeah, so there certainly are many different ways. This is a procedure that's been around for a long time. There are many different ways to reconstruct the ligament, different graft sources of what we use to, a graft is what we call the tissue that we reconstruct the ligament. This would be just a model that I brought, would be a soft tissue. This is a rope, but we'd use some sort of soft tissue. We make little holes in the bone, in the shin bone and the inside of the end of the thigh bone. This has a little metallic button on it, which you can't see it a little bit there. And we thread a suture through those tunnels and sort of slide the new graft
through the
up
bone.
through the tunnels.
And those tunnels are done by you guys, right?
Yes, that's
those
something that we do
tunnels.
in the operating room.
Right.
And then the button sort of slides through the tunnels and it flips, and then we pull back on the graft. It seats itself on the outside of the bone and reconstruct the ligament and fix it on the shin bone side.
So
as well.
after you've reconstructed the ACL, you were saying this is really great for patients who are still active, right? So how quickly are they able to get back?
So usually we get folks into therapy pretty soon after the procedure itself. They're usually able to get off of crutches around 3 to 4 weeks once their gait and how they walk returns to normal. Patients are typically feeling pretty good around 2 to 3 months, getting back to their normal activities and actually want to do more, but we really hold them back because that's when the graft is usually at its weakest, actually. So patients are feeling really good, but they're not able to do those cutting and pivoting activities quite yet. We are able to get them back around 6 to 8 months, though, sort of free reign and do whatever they want after the surgery.
Are there certain exercises and maybe some training programs that people can do to prevent the risk of injuries to the ACL?
Yeah, it's been sort of a hot topic in ACL injury, looking at how we may be able to prevent these non-contact injuries. There's been a lot of jump training or plyometric type programs that have been developed. There are actually some substantial research behind showing that it can reduce the rate of non-contact ACL injuries, although it can't completely eliminate the risk of injury.
So this isn't something where you plan ahead. Like, well, come March, I'm going to tear my ACL, so
Yeah,
I better.
that's for sure.
But we appreciate having Dr. Samuelson here today, hoping that you kind of you recall, right? I remember seeing this on the Morning Blend, this procedure that really gets you back to that active lifestyle, because that's really what it's about, is having a procedure go well so that you can maintain your way of life. So CHI Health Orthopedics online, you see the website there, and then the number is 717-0820. But one of the things we want you to know about Dr. Samuelson is he's a Nebraska native, and now at CHI Health, obviously helping Nebraska patients, and we like that part of your story.
Yeah, thank you.
Thank you for coming in.
Yeah, we appreciate it.
I hope I never have to see you,
Oh, that sounds
but I'm
good.
going to keep you in mind
All right.
should I ever. Thank you.
Guess